So much, Nicole. It's so fun to do this with you. This is a blast from the past, the photo that you see here. I got the had the distinct pleasure of meeting Nicole when she was a postdoc. Um, and we've thankfully remained very connected with our teams over all these years. So you see us there from the CERT conference in 2015 with several of our wonderful colleagues. So it feels great to be able to connect in this way, bring our hubs together in this way, and do this session together on assessing context and implementation research using qualitative methods. Next slide. So just a little bit about us. I'll just do a brief introduction, and then Nicole will do the same. So we both are coming from our respective hubs that are funded by NIMH to support ending the HIV epidemic supplements in implementation science. So I lead the UCLA Rapid, Rigorous, Relevant, or 3R Implementation Science Hub, which is attached to CHIPS at UCLA in the Department of Family Medicine under the leadership of Dr. Steve Shoptaw. And I'm a professor at UCLA in psychiatry and a research career scientist at the VA in Los Angeles, and an implementation scientist. And Nicole, do you want to do your intro?
Absolutely. Thanks so much, Alison. So I'm the co-director, co-principal investigator of our San Diego Center for AIDS Research Implementation Science Hub. The other co-director, I believe, is on the call with us here, Dr. Borshika Rabin. I'm an assistant professor. In 2 weeks, I'll be an associate professor in the Department of Psychiatry at UC San Diego. I'm the director of our Director of Dissemination and Evaluation of our Altman Clinical Translational Research Institute's Dissemination and Implementation Science Center. I'm also at the Child and Adolescent Services Research Center. And finally, I am the Administrative Core co-lead of our newly funded InStep Children's Mental Health Research Center, which is an Alacrity P50 NIMH funded center, also a co-host of our session today. Thanks so much.
Thanks, Nicole. Okay, so we do have a pretty packed agenda. We're very excited about this topic, so we're going to give you lots of information and lots of examples. I'm going to just get us going by talking about context, what we mean by context, why it matters in implementation science, and how qualitative methods fit into that. And then we're going to really spend the bulk of our time diving deep into ways to assess context, including ethnographic approaches. I'm going to talk about a couple approaches in that area, and Nicole is as well. And Nicole is also going to share work with us that she and her team have been doing on theory of change and brainwriting PreMortem. And I'll just spend a few minutes at the end wrapping us up. So lots of good stuff ahead. And the resources, we probably will add to them. So if we mention things as we're talking and you think, oh, I want something on that, feel free to put that in the chat, because we can always add to our resources, some of which were selected based on questions that people submitted for that 30-minute session at the end. So if it's a little, unusual how we set it up, it's because we wanted to be responsive to the resources that people requested for that follow-up session. And then if there are other things that we can add to support your knowledge, definitely let us know, and we'll expand our growing resource list from 2 to 3 to 4 pages, who knows. Okay, so I just want to get us all grounded on the same page. We can go to the next slide with a definition of implementation science. I am guessing that those of you who are with us today know what implementation science is. So I don't say this to question that, but rather to highlight the role of context in definitions of implementation science. And in this definition in particular, from a great paper by Mark Bauer and Joanne Kirchner about implementation science, where they say that the crux of this field is to identify uptake barriers and facilitators across multiple levels of context, and to develop and apply implementation strategies. And they make this point that I think has really critical implications for qualitative methods, really for all of our methods in implementation research, which is that implementation science protocols don't ignore or control for context, but actively seek to, sorry, the chat is blocking the screen, seek to intervene to change the context in which clinical innovations are used in order to enhance their uptake. So this is so important to how we think about the use of qualitative methods in terms of this focus on changing context. And that might be to stand up something new. It might be to undo something that is not, hasn't been determined to be effective. But at the heart of what we're doing in implementation is changing behavior, changing context, et cetera. And so when we're thinking about qualitative methods, it really kind of puts that in the forefront, whereas in other applications of qualitative methods, they may not be oriented so front and center toward change. But when we're trying to use data to help us with those changes, we really have to get creative and flexible with our methods, maybe that we were trained in one way and need to learn how to adapt and tailor them for the work that we do in implementation research. Next slide. So Carl May, whose work is always provocative and excellent, said that context is a problem for implementation science. And really, I think what he refers to is that context is dynamic. It's something that's always changing. It's really not something that we can quote unquote capture. We need to characterize context, but this idea that we would capture it kind of suggests that it's this static entity that we can thoroughly measure, thoroughly assess, and completely and comprehensively characterize. And that's it's just really not possible. We can do a lot. We can do a lot to characterize context, but it's always going to be changing, moving, very dynamic. And so, qualitative methods are very well suited to this ever-changing environment in which implementation is happening. We can think about context in many different ways. A fairly recent scoping review characterized 4 dimensions of context in their review: physical relationship, location, identity, and culture. That those are 4 aspects that are pretty commonly assessed when looking at context. And in the right, I just raised some questions for us to ponder as we go through this session. Sometimes when we're doing implementation research, we think, well, what is the context that we're entering into, as if it is, again, this sort of fixed, static space and place that we come into and try to do what we do. But we really want to shift and change that way of thinking about context in terms of what is this living, breathing, dynamic, busy, active place where we're trying to do something that's probably going to be really hard for us and for the folks who are asking to do it. And how does context work? What do we mean by that? What do we mean by the ways in which context is affecting, shaping, transforming, influencing our work and implementation? And how can we represent that? Of course, I'm guessing that, sorry, just get back to our slides. I'm guessing that you all are quite familiar with theories, models, and frameworks in implementation science. There are some resources on your list that can help you with that if you need help. And Nilsson and Bernardson did a review not so long ago of frameworks that address contextual determinants and found 17. So most of our probably most commonly used frameworks in implementation science do have a context piece, or maybe more than one context piece, like we might think of inner and outer context, for example. But in some way or another, with some type of terminology, many of our most commonly used frameworks do have a context element or component, and it's typically viewed as very multidimensional. Some have argued that we're not quite where we need to be with understanding context, that maybe it's partially mature. And I think this ties back to Carl May's point that context is a problem, but we're trying to solve that problem using the methods that we're going to share with you today. Next slide. And you can just do 2 more clicks if you don't mind, Carrie. Thank you so much. So I don't want to spend too much time here because we have a lot of examples that we want to, really illustrate these points with. But just in terms of ethnography, that's going to be a big focal point for us today because ethnography is extremely well suited to understand context and assess context. And really ethnography, as Nicole is going to talk about more in just a little bit, first of all, it means a lot of different things. It's both something that we do and something that we can produce in ethnography. And typically ethnography involves a collection of methods. So here what you see in the diagram is the spectrum of qualitative methods, from unstructured, very inductive, exploratory qualitative methods all the way to structured qualitative methods. And there's a wide range of possibilities on this spectrum. Typically in implementation research, we are using semi-structured methods, at least historically speaking, but I think that is changing and shifting, and you'll see some of those changes in what we discuss about the use of ethnography to assess context. So there's more and more work emerging toward the unstructured side of the spectrum. Not to say that we're going to stop using semi-structured methods in implementation research, but just to say, can we, consider using even more of this spectrum of methods, especially when we think about all of the potential that ethnography offers this field. So it might be that in your methods, you're including some structured elements. You'll see that in our examples. There are several structured elements that just help with consistency of data collection. They help with analysis approaches. They help with team-based work. So having even a little bit to more than a little bit of structure or semi-structure in your data collection efforts and purposefulness in your sampling approach, et cetera, can really help with the types of work that we're trying to produce in these tricky contextual assessments. And that may also mean that you're building in some structure even into observations, which are a key part of ethnography. Next slide, please. So I'm going to just go through a little bit about some different ways to study context and a little bit about focused ethnography, and then I'll hand it off to Nicole. This paper is a really interesting study of 14 research teams who are reporting contextual factors that were important for practice change. The contextual factors that they found to be important across these teams were practice setting, a larger organization and external environment, implementation pathways, and motivation for implementation. And they recommend several different steps that one can take to understand context in terms of obtaining diverse perspectives, multiple data sources, as I mentioned before, considering multiple levels. And we might think not only of multiple levels of an organization, but multiple levels of the intervention itself. Maybe it has multiple targets, for example. We want to understand the history and evolution of context over time. Again, not thinking of context in a static way, but rather thinking about, what's made this organization or this clinic or this setting what it is today, and why might that be important to our understanding of what's happening with implementation. We want to look at formal and informal systems and also assess interactions between contextual factors, processes, and outcomes. And there's a very handy context matters worksheet that goes along with this paper that I recommend taking a look at. And our next approach on the next slide, please, is an approach developed by Mike Fetters and Rubenstein about the 3 C's. I absolutely love this, this way of thinking about things. They talk about the value of assessing content, context, and concepts, a very practical approach to recording unstructured field observations. So you see the 3 Cs, that's just a little screenshot from the paper itself, but then much of that is shifted over into the observation template that you see on the right, where you could consider developing a template that has some prompting questions about each of those C's: context, content, and concepts, and set it up so that it's loose enough and flexible enough that people can approach it in different ways, because these are going to be people's observations and things that you learn that you didn't know before, et cetera. So there will be some sort of individual variation in how this is completed, but yet it has a bit of a structure, so we can kind of park or compartmentalize what we're thinking about in terms of those 3 Cs. So this might be a really valuable tool to incorporate into your implementation research. Next slide. And then I just want to touch a little bit on focused ethnography. You might find, if you're getting interested in this area, that there are lots of different terms for ethnographic approaches that are not traditional. And by that, I mean, I am an anthropologist, so I was trained, I think, in more traditional ethnography, where you go to the fields for a very long time and you live a life, and that's pretty different than what we do in health services research and implementation research, where that's not usually our setup. We need to be more focused. You might see targeted ethnography, you might see rapid ethnography. There are many, many different approaches, which is kind of beyond our scope today. But just suffice to say that there are several different approaches to a more circumscribed approach to ethnography, such as focused ethnography. And what this review paper that provides guidance suggests is that focused means we're investigating specific beliefs and practices of particular illnesses or processes. So we're getting into specific questions. That's the focus. And another key piece of this, which is a bit different than maybe much traditional ethnography, is that the findings from a focused ethnography are really expected to have meaningful application. So going back to that definition of context, of implementation science, and thinking about context and the fact that we're really trying to change what's happening in context, that this is where the role of focused ethnography can really fit in terms of supporting and informing the changes that we're making. They make the point that focused ethnography is different from rapid appraisals, micro, mini ethnography. Some of this could get us into semantic territory that we don't need to worry about too much today. But suffice to say that there are, different approaches to ethnography. And, we'll walk through a few examples, and then Nicole has some great examples to share as well. Next slide, please. So this just gives you a little bit of a comparative view of how we might think about focused ethnography in relation to some work by Bicker and colleagues on team-based multi-sited focused ethnography. In blue, you see a lot of these similarities, like a focused field of inquiry. It's typically we have a problem-focused orientation, a problem-focused research question. Our data collection in focused ethnography is typically short-term and targeted, and we are being really purposeful about our sampling approach, as I mentioned before. So whereas in a traditional ethnography, you might want to talk to and attempt to talk to pretty much everyone who's available to talk to, whether it be informally, formally, using different methods, et cetera. But because our time and resources are typically more limited with focused ethnography, we're not going to have that luxury, we might think of it as, of talking to everyone. We really need to talk to people who have a lot of knowledge, who are very information rich, as some saturation work suggests. We're going to use purposive sampling. Doesn't mean that we wouldn't be open to being informed that there are other people we should talk to. But at least as you start, you're really kind of honing in on the people who will know ostensibly the most about what you need to know for implementation purposes. And as I mentioned before, you might incorporate some element of structure into your data collection efforts. Next slide. I think I have one more example to share with you, if I'm remembering correctly. This paper by Bunsen colleagues, which is an ethnographic process evaluation, provides a really, really great food for thought in terms of how to use ethnography. And they mention placing the intervention in a historical and social context. Being there is a big part of ethnography so that we can really document process as it unfolds and being open to unanticipated consequences. We're really asking, what's happening here? Why is it happening? How can we understand that? And thinking about what methods can we use to document what we're observing. So they chose what they called less intrusive methods as a primary form of data collection. They had site coordinators who were based at the sites. Training is something that often comes up when we talk about using ethnography and implementation science. In this case, they did a 2-hour training to help their team understand the goals of data collection and get some training in how to ask good questions and learning how to listen. Next slide, please. And they used this weekly site coordinator feedback log. So at first they started, I hope I'm capturing this correctly, but at first they started with a pretty structured approach to keeping diaries, and they found that they just weren't getting what they needed from them. They got a pretty low yield. So they opened it up. They opened up the question and the approach to say, include anything in this log that might help us understand barriers and facilitators to implementation of whatever the evidence-based practice is. And in the training needed to make sure that the team understood why they were doing this, which is always going to be important in our methods, that everyone who's using those methods really understands, what the purpose is, what they're trying to get from this particular method. And they emphasize considering this as really a conversation or a dialogue between the person completing the diary and the ethnographer, incorporating lots of different perspectives, observations. You see the potential topics for the log, like this idea, for example, of surprises and challenges that may come up in the field. And one of the values of this that I think Nicole is going to speak to as well is that, if we're only interviewing people 2 or 3 times during the course of an implementation study, there's all that stuff that's happening in between the interviews that we just don't capture. And so having an additional method or set of methods that gets at the in-between spaces, especially the things that we didn't expect, didn't anticipate, which of course happen all the time in implementation. There are, a growing number of tools and resources that we can use to capture the in-betweenness of this type of work. Next slide. And I remember now I'm going to talk about reflections. Yes. So one more piece from me, and then we'll turn it over to Nicole. So I want to share with you an ethnographically informed method that Erin Finley and I and our team developed, really in an effort to do just what I was mentioning in terms of how can we get more at that over time aspect of implementation, really understanding what's happening in between other moments of data collection. So this is really meant to be an ethnographic approach that allows for close engagement with the understanding that, the research team can't be everywhere at all times, can't, be familiar with all settings, all contexts at all times. But we have typically people in those settings that can really help us be our eyes and ears. Periodic reflections is meant to be a low burden. This was really important to us, to have a way to document events that were happening, but not in a stressful or highly demanding way. These are brief phone calls with implementation team members and key implementers. They are lightly guided and very flexible, allowing for perspectives on, what's happening, why is it happening, who's involved, when are these different things happening. And we really tied our approach to this to complexity theory in terms of it being an opportunity for reflection, as is indicated in the name of it, and for sense making, and being someone who reflects in using this method. It really has been for me a time to kind of download everything that I've been doing, working on, observing, thinking about, and getting it all documented using this particular tool. Next slide. So as I mentioned, these are brief phone calls. They're approximately monthly, not always monthly. That's why we call them periodic, because we want them to be regular, but they may, it may be that you don't do one for 6 weeks or something like that. But we try for regularity, particularly monthly if possible. These can be done with individuals. They can be done with dyads. Sometimes they're done with teams of people who are on the ground involved with implementation. And our hub, Erin and I did a YouTube workshop on periodic reflections, which is part of our YouTube playlist. So you see the link here to the periodic reflections training that will give you a lot more information about this. And we'll also share, I meant to stick it in, but we'll also share a template that we use for the reflections when we send out the resources later. So the few things that we tap into in the reflections are the main things that have been happening lately, let's say in the past month, any adaptations that have been made to the intervention. So it's a great way to capture adaptation, not only to the intervention, also to implementation. It's an opportunity to discuss stakeholder engagement and also things that are changing in the local, regional, national, global environment. Next slide. We're really so happy and gratified that many different teams are using periodic reflections. So these are just a few examples of projects and implementation scientists that are using this approach. Next slide. I just want to give you a little snippet of what we see in a reflection. This is from one of our projects about tailoring the diabetes prevention program, which is highly evidence-based, to the needs of women veterans. And in a reflection, one of our implementers said the in-person groups are done. That's part of the EBP. We're thinking about doing a monthly maintenance session. Not very many people want to come, but a few would be interested. We have funding for the leader through September, so we could do them through then. So they're considering a modification to the intervention, and we used Shannon Wiltsey Sturman's frame to code adaptations to the intervention. So, there's a lot to explain about this, but it is in our workshop, and we're also happy to answer questions. Erin's going to be in and out with us today as well. So if there are questions about this, we can get to them later on too. So I think next I'm turning it over to you, Nicole. Is that right? Next slide.
Yes, that's correct.
Great.
Thanks.
Thanks, everyone.
Thank you, Allison. I could listen to you all day. I don't know if anyone's told you, but you should consider podcasts or narrating meditation apps. You have a wonderful voice for to listen to.
I mean, I'm making you sleepy though.
No. I'm actively engaged.
Okay.
So I'm going to share about 3 methods that qualitative methods that we've been using in 2 of our linked community engaged public health research projects. This slide here is also just a reminder to, if you need to take a movement or hydration break, please do so. And I'll tell you a little story about this mug here that I have pictured. I'm not sure if anyone has done this before, but Borshka Rabin, our creative and wonderful colleague, I wouldn't say threatened, but offered that once we got this paper published, she would print it on mugs so that we could all carry them around and remind ourselves about the opportunities and challenges that went into the paper. I have my mug here. You can't see it too well. And so we did get this paper published, and we did create mugs that I use my mug weekly. So the method that we used here, thank you for the love of the PubMub. The method that we used here is an ethnographic approach to assessing engagement, context, and process. And on that beautiful spectrum that Alison shared about kind of unstructured to structured ethnographic approaches, this definitely is on the side of the semi-structured to structured approach. And I will walk you through some different forms that we developed and used and refined to be able to assess the engagement context of our studies. So if we can go to the next slide, and I'll just re-ground us about some best practices for ethnography and implementation science work. So ethnography, as Alison has shared about, is being increasingly used to provide this contextual understanding of processes, complex interactions, dynamism, and diverse views. Some recommendations for use of ethnography is to consider how to iteratively develop methods, value the reflexivity of the researcher and the documenter in the process, and contextualize findings by considering both the local and then the broader political, socio-ecological context from multiple perspectives of your partners who may represent different levels of a service system or an implementation context. So in the paper here that I'll describe, we used a multi-method ethnographic approach to document and assess engagement, which, although we talk about community engagement increasingly more, the systematic and kind of rigorous ways to evaluate engagement need some work and improvement. So this was one of our attempts to do so. Next slide, please. So in terms of our methods, the kind of data source that we used were two community advisory boards from two separate but related research projects focused on addressing COVID-19 disparities. And so we included 33 partners from 17 groups who comprise these community advisory boards. We held 15 advisory board meetings, and we trained primarily undergraduate research interns and I think a few master's level research assistants to observe our community advisory board meetings using these ethnographic documentation forms that I'll show you. And in the process of developing these forms and training our documenters, our community, our very, very wise community partners from the Global Action Research Center who facilitated our advisory board meetings, they suggested a change in terminology. Rather than calling what we were doing, the ethnography, observing or training people to observe our sessions, they suggested that we call this whole process innovation documentation, and that the individuals who we were training to use our documentation forms were documenters. Again, because these were community advisory board meetings, and we had many community members who have had different experiences with researchers and with research, we wanted to build a real authentic sense of trust, and we didn't want people to feel like they were being observed and examined in a really kind of scientific researchy way. So innovation documentation was the term that they recommended, and it really resonated with us as a research team because the engagement process and assessing engagement is still a kind of relatively new area of work. So in addition to training our documenters and using these documentation forms, after each one of our advisory board meetings, we debriefed with our documentation team, and that really supported our quality assurance and whether or not we needed to make any refinements to the documentation forms or how we were all thinking about the different kind of components of our forms. At a midpoint in our advisory board meeting process, we paused our documentation data and used content and rapid thematic analysis to really characterize the kind of engagement that we were seeing among our different partners. Next slide, please. So I'll walk you through a couple of our forms. And actually, before I launch too much into the forms, I'm just curious if people could share in the chat or even just raise your hands if you've had experiences or used ethnography in your work. I'm curious to kind of learn a bit about your experiences. So maybe Borshka raised their hand. Oh, people are raising their hands, which is great. This is so cool. You can also include it in your chat, yes or no, if you've used ethnography. I'm seeing some raised hands. Excellent. Yes. Oh, wonderful. Okay, great. So we have some experienced ethnographers in the group here. Excellent. Well, please do share your thoughts and feedback about some of the forms that I'll share with you here if they may be applicable to some of your work. So this is an example of one of our documentation forms, really kind of setting the scene. So in this, it's fairly straightforward. We asked our documenters just to describe who was in these virtual advisory board meetings. Were they watching the meeting live or via a recording? What was the purpose of the meeting? Usually we set the agenda ahead of time and shared that with the documenters, but sometimes there were opportunities to change the agenda or add in emerging topics. Oh, and thank you, Borshka. Borshka is sharing the publication, which also includes the ethnographic forms that you can download and use. Oops, I'm trying to advance to the next slide and I'm not able to. Carrie, can you do that for us? Okay, great. So this next form includes the who, the actors. So we typically asked our documenters, and I think we had between maybe 4 to 6 who were part of one of the advisory board meetings completing these forms. And we would ask them to focus on specific subgroups of the advisory board. We had representatives from different community organizations, as well as public health partners and clinic partners who were part of the public health initiative. So we included here, we asked our documenters to just share the names, the organization, the partner role of the individual who they were documenting. We did ask our documenters to monitor the amount of time in minutes that an individual was speaking or making comments as a way to kind of quantify the level of their interaction and explicit engagement in the meeting. I think let's go to the next slide. So acts, so these are what people were doing. This was the what. So in this, people would, our documenters would describe if the individual, when they were speaking or engaging with others, if the purpose of their comment was to clarify information, to seek information, to respond, whether they were voicing agreement, summarizing what they had heard, making a closing remark, or any other sort of a comment. We really wanted to just understand and characterize the what of their engagement in these meetings. Okay, next slide. And I appreciate, Anna, your comment here about innovation documentation. Thank you. You said it much better than I did. So I appreciate that endorsement there. The next part of the engage or the documentation form that we trained our documenters to use was simply their perception of a partner's role in that meeting. And they could have multiple roles. They could have no active role. Maybe they just listened. Oh, hang on a moment. I'll continue to
Sorry,
share.
working on it.
Okay. Thank you, Carrie. So the partners could have no role, meaning that they maybe just listened. They were physically there, but didn't maybe say anything or engage with others. Another role was that they provided input. they could identify priorities of either the meeting or of the larger public health project. They could participate in the program design. Um, they could set the agenda, or perhaps they led or co-led the meeting. So we asked our documenters to kind of report on the types of roles that an individual in the advisory board meeting held. So in the paper, and again, we'll make these slides available for you. I think we're, oh, wonderful, Carrie, we're on slide 28. Yes. We wanted to share a little bit about the results from using these different documentation forms. So this is an example of that partner survey that I just shared with you. The percentage of meetings in which a partner reported serving in each of those roles, from no active role to led or co-led the meeting. And so we were pleased for the most part that our partners, our community partners, health clinic partners, public health partners, and our Global Action Research Center partners, there was less, 50% or less of their time in the meetings, they had no active role, meaning that they had more engaged roles. So for example, in identifying priorities for both our Cocreate project and our Stop COVID-19 projects, our partners had an overwhelmingly high percentage of meetings in which they identified priorities. So that was positive news for us. If we go to the next slide, we also were able to report a thematic analysis of interruptions by our advisory board members. And by interruptions, these weren't necessarily disruptive. They were more, we wanted to characterize when people did speak up or share their perspectives, what was the purpose? And so we were able to categorize these into three major interruption purposes: clarifications, responses or opinions, and sharing about logistics or questions about, kind of technology concerns. Oh, I didn't hear that. Can you repeat it? Or if they were having difficulties, or just comments about the different video platforms we were using. Okay, next slide here. So this table here, again, also produced from our analysis of our documentation forms. It shows the partner interactions to characterize those. And I'll share in just a moment, the theory of change was really the main activity that we led. You can go to the next slide, Carrie. The theory of change was really the main activity that we led across both projects for most of the advisory board meetings. So not surprising that the majority of the interactions among partners were related to different ideas to generate and produce the theory of change in our sessions. And so this table just illustrates the topics that were generated for the theory of change related to policy and government, accessibility, misinformation, things like that. So again, this is just another example of what you can produce based on the documentation forms. And I think if we go to the next slide here, and I think Borshka already shared the link here. Again, all these documentation forms, they are available for you to download. And I'll pause here for just a moment. If you can go back to that last slide, I just want to scan the chat to see if we have any questions or other comments that we want to address. Okay. Borshika, anything else that you'd like to share about this particular paper or the documentation methods that we used?
Thank you so much, Nicole. No, I mean, it was so much fun. And I love the comment of, how this innovation documentation language, which we didn't think about until our community partners pointed it out. Perhaps the one comment I will make is we learned that the form can be very cumbersome to complete. So over time, it just got simplified. And our current studies, we are trying to make them even more kind of streamlined. So reach out if you would like a more streamlined version. And we would love to hear if you are using something similar, what do you recommend and what are you documenting?
Thank you, Varshika. Okay. I'm not seeing any other comments or questions. Oh, there's a couple of questions here from Anna. Let me take a moment here. Okay. So the question here, and we can decide, Alison, if we want to answer it now or if we want to wait. How do you approach rare events in thematic analysis? So if someone shares a unique, detailed perspective that does not fit in with the existing themes, how do you prevent it from getting washed out or ignored if you're concentrating on the most frequently occurring instances? Alison, should we take this now or later? I think it relates broader to analysis, not necessarily to ethnographic analysis.
Yeah, I think it's a great question. I would say let's hold on to it for later, but let's definitely not forget about it because it is a really important question. But it may take us a little few minutes to get into it. So yeah, if we could hang on to it for later, that'd be great.
Okay, wonderful. Let's earmark it for our Q&A part. I think Anna Lau has a maybe quicker question. Is the form able to be completed in real time by coders? Yes. So those forms that we shared, we had documenters who were both live in the meetings, completing them in real time. If they couldn't participate or attend live for some reason, we recorded them and they were able to complete them in kind of real time asynchronously. I believe it did take them a bit of time though after the meetings to sort of calculate some of those time tracking pieces and maybe to kind of reflect on the partner roles. But for the most part, they completed those forms in real time. Thanks for the question, Anna. Okay, I will launch us into a second example and method that we used in two of our projects here. So this was co-creating a theory of change. Now, again, by show of hands and or in the chat, who has experience using a theory of change method? Anna K. Excellent. Marshika. Okay, so maybe fewer of you have had experience with a theory of change. So I will walk you through it a bit. I would say it's a unique application of qualitative methods. Again, we used it really not only as an engagement method, but also to assess really kind of the public health context of COVID when in the kind of early stages and phases of it. So let's go to the next slide. Theory of change is a comprehensive illustration of how and why a desired change is expected to happen in a particular context. It's been referred to as a logic model on steroids. And you can see that the generic theory of change really talks about kind of a North Star that you're working towards, and then underlying that North Star, what are the necessary preconditions, measures of success, and actions that are needed to produce that North Star or kind of ultimate success. So on the left-hand side, we have a figure of a generic theory of change. And then on the right-hand side is our very colorful theory of change that we co-produced with our community partners across those two public health projects. And I'll walk you through a bit more detail of how we came to produce this theory of change that we've continued to use as sort of our guiding framework for these projects. So on the next slide, we can go there. And so again, our main data source were our community advisory board meetings. Again, we had advisory board meetings for 2 of our projects. Cocreate was one project. Stop COVID-19 in California was a second project. Again, we met virtually. We completed more than 20 meetings, and we continue to meet with them. We used Zoom and Miro boards, which are like little sticky note boards that we had different scribes in breakout rooms type out, and then we could join together into a larger room to kind of place the sticky boards across the web page. So a couple of lessons learned just broadly for these advisory board meetings that were really helpful to our work and to our creation of the theory of change. We needed to translate all of our materials. We did have individuals who spoke Spanish as their primary language and English. And so, and again, to make sure that we had just all the opportunities for engagement as possible, we tried to ensure that all of our written materials were translated, and we had a live interpreter who often reminded us to speak slowly during the meetings. There was a need for ongoing technical assistance with the different devices that we offered to our community members. We met in the early evening. That was typically a good time after school, before dinner time for people. We also had 2 scribes in each breakout room to take notes, really kind of take observation and field notes about what people were saying and commenting on. And then our community partners at the Global Action Research Center, they always saved time at the end of our meetings for reflection. Just a simple question of, what will you take from this meeting that you'll continue to think about over the week? And we actually started to record and transcribe those open-ended responses. And I believe we actually included some of them in the former paper that I talked to you about. Those were really powerful quotes from people. Okay, next slide. So this is the composition of our advisory boards on those 2 projects. So you can see across Cocreate and Stop COVID-19, we had community partners or leaders from multiple different organizations. Our Cocreate community partners were primarily from Latino communities, and then our community leaders from our Stop COVID-19 work were primarily from immigrant and refugee community organizations. We also had public health partners or policy partners, and then federally qualified health clinic partners for one project. So really unique and diverse perspectives included in our advisory board. If we go to the next slide, you'll see this is the structure and the content of the theory of change sessions. So this occurred over 7 sessions. And in this table, we included the very specific agenda and activities that we engaged in to produce those theories of change. And I'm actually, for time, I'll move us along just so you can see an example of what one of the sessions look like. Oh, and I'm sorry, I forgot that I did get fancy on the next slide and used animation. So Carrie, if you can just click multiple times. I think there's, yep, here we are. So this is an example of the agenda and process for one of the theory of change sessions. So the goal of that session was to identify the factors contributing to disparities in access to vaccines and participation in clinical trials. And so what we did was we presented the focus question of that session. Everyone individually thought through their own responses. Then we broke people out into 2 groups. They shared their responses. We called everyone back into the same room using these Miro sticky boards. And then we participated in sorting and naming the responses based on a theme. Once we sorted all of those, we then named the themes together. So I think I have, oh, on the next slide here, this is ultimately, oh, next slide here, thank you. This is ultimately what we came up with across both projects. So the common themes related to, again, reducing or really eradicating disparities in COVID-19 testing and access to care were related to language and cultural barriers, information and communication barriers, access to care, and socioeconomic barriers. And then as part of the theory of change process, we also identify the necessary conditions, actions, measures, and indicators of success. And so in this kind of combined figure, this was what was produced as a result of these theory of change sessions. Okay, I think let's move us along. So this is the method that we've used a couple of times now. It's super exciting, super fun, really helpful. So I'll also just pause here and ask you all, has anyone used Brainwriting PreMortem in your work? Either raise your hand or include it in the chat. This was a newer to me method, but we've used it in a couple of different ways. Thank you. No, okay. Okay. So the Brainwriting PreMortem, it's, oh, someone has used it. That's great. I saw one raised hand. Very, very good. This is a participatory qualitative approach that combines both an individual's own brainstorming of solutions and pre-mortem reflection, where you think about potential failures before a program's launch, as well as ways to address those potential failures. That way, you're trying to kind of pre-identify and address things that could go wrong before implementation. And the figure that I have here, this is the generic guide that Heather Gilmartin and colleagues developed. And so you can see here, the questions are pretty simple. It asks people to think about a particular program that's going to roll out. So you can insert the name of your program. And to set the stage, imagine that the program has been running for about a year and it's been a huge failure. I want you to write out specific reasons why that program failed. People write out their own individual reasons for failure, and then the facilitator brings everyone back together and says, okay, great, we're going to use this to adapt and strengthen the program. We extended that a bit more, which I'll show you about, to actually walk through each of the failures and come up with potential solutions. So the first, let's go to the next slide. The first example here, again, we used across those two COVID-19 projects, or actually, sorry, just the one project called Cocreate. And this is a paper that's under review, and it's an abstract that was accepted as part of a symposium at the Association for Behavioral and Cognitive Therapies. If you're going to ABCT in Seattle, I'll see you there, and maybe stop by and you'll hear more about this project there. But I will share, if you go to the next slide, how we adapted Brainwriting PreMortem for that study. So we used Brainwriting to refine a COVID-19 testing program that was offered at a federally qualified health center. We conducted interviews, individual interviews, with 11 patients of the clinic and 8 providers from different medical departments. These were 30-minute Brainwriting PreMortem interviews that we conducted before program launch and then midway through the program. The data were transcribed, translated, because we did have individuals conduct these interviews in Spanish, and they were analyzed using a rapid qualitative approach. So I'll give you an example. So this is what we did. Sorry, the next slide. So what we did in these interviews, we showed people the proposed workflow of the testing program. So we first, when we met with either the patients or the providers, we explained, this is the proposed workflow to get tested. We walked them through what would happen before they got tested, how long each of the steps would take, what the testing process would look like, how they would get the results, and then what would happen after they received a negative or positive result. So we walked them through this. We also created I think like a 2-minute video that described this. So if people wanted to listen to it or review it on their own time, they could also have access to that. On the next slide, we have the actual interview guide that we used. So first part, we reviewed the workflow, and then we let them know. So imagine that this testing program has been running for about 6 months. First, take 5 minutes to write out the specific reasons why you think the program failed. And we did, initially, we received a lot of question and concern from our partners about the use of the word failure. And in particular, I have to give kudos to Borshika, who really encouraged us to stay true to the original method and use that word failure. It causes a good reaction, a strong reaction. And all of our participants who have engaged in these brainwriting sessions have actually really resonated with that word and have provided us with really, really rich, kind of no holding back feedback. So definitely, if you're going to use this approach, use the word failure. So then after people thought about their individual failures, then the interviewer asked them to rank their top 3 reasons. And then we asked them, let's start with the most important reason for failure. Do you have suggestions or ideas about how to avoid or address this? So then we did that up to 3 times for the failure and then potential solutions that they came up with. Okay, next slide. So findings, we really received very actionable strategies that we were able to incorporate either real time or kind of shortly after. And these were related to return of results, placement of where the testing locations were at the clinic, and changes to recruitment strategies. So again, really, really actionable ideas from these pre-mortem interviews. And so for time, I'm going to, I'll spend maybe just 2 minutes walking through this so we have time for kind of closing thoughts and then more of your questions. So a second example of this brainwriting activity, we did it with our community advisory board, actually. So we did it in a group setting. And this, we've adapted our testing program to now offer testing through vending machines. People can request a rapid test kit through a vending machine rather than going up to a walk-up clinic or setup. So again, we set the scene by explaining this new testing approach. We asked people in the advisory board to first think through their own individual potential failures of this approach, and then we brought them back together to address each of those failures based on their kind of collective wisdom and experience. So next slide. Again, this is, we would walk through the proposed workflow. If we go to the next slide, I think we can skip two actually. We can skip this one. What we did was, after people had a chance to think through their potential failures, we then shared back with them a summary of the failures that they came up with. So we shared within this pie chart, most of them are related to accessibility and kind of ease of use of our vending machines, but there were a number of other topics and failures that people came up with. So after we reviewed those themes, on the next slide, we showed them a table that summarized the potential failures by theme. And then we, as a kind of internal group, we prioritized which ones we wanted to address that were kind of the hardest to address with our advisory board. So if we go to the next slide, I'll show you an example of what we did together. So we reminded them, many of you shared that literacy or difficulties with literacy was a potential failure of our approach. Not everyone can read well. A live person may be needed to help with this process. So we came up with some possible solutions, including developing a video of the instructions and other options for registering and accessing this test. Question for the advisory board was, what should be included in the videos specifically to address this failure potential of people's difficulty with reading? And then another example, if we go to the next slide, we shared that a failure that people shared about was trust or mistrust in research. How can we make this less of an issue? We brought that back to the advisory board to generate their ideas for addressing that solution or that failure. So I think with that, Alison, I'm going to pass it back to you to take us home and wrap us all up. I think we provided a lot of really concrete and different examples of these methods. So I'll invite you to help us wrap up.
Thank you so much, Nicole. What I love about what you shared is that it really demonstrates this marriage of community engagement and ethnographic methods, qualitative methods, again, to help us assess context. So it really, just illustrates how flexible this approach can be and how creative and innovative you can be with your use of qualitative methods to assess context. So we just wanted to wrap up with a little bit of a rubric. This does not have to be specific to ethnography, but just in thinking about assessing context ethnographically or using other methods. So you could insert the methods you're interested in if you want to replace ethnography with something else. But just kind of walking through, our who, what, when, where, why. I think especially considering what Nicole shared about who can be involved in this process, really expanding our notion of who can be a documenter, for example. I love that switch in terminology, which at first seems simple, but is very meaningful, especially when it's a switch in terminology that comes from the folks you're working with, who say, this is what we want to be called, this is what we want to do. So I think, just thinking through in terms of assessing context, really having a clear understanding of what you think your methods will do for you and how they will answer your research questions, what those expectations are, because of course there's no method that's going to give us everything we need, right? So what are the limitations, what are the strengths, and how are you going to conduct that? Ethnography or other, use other types of methods to assess context. What methods are you choosing to use and what's your rationale for those? And I think you heard really great examples from Nicole about, wanting the community members to be absolutely central and integral to these processes and to next steps with implementation. One thing we didn't get into extensively, but we certainly could talk about it more, is just we heard about the theory of change, innovation, application, super interesting, and just thinking more broadly about, when we're using theories, models, and frameworks, how do we do that and still remain open to what isn't part of those theories, models, frameworks, to what might be more emergent, to what's unexpected, what's surprising. And you saw that in some of our template examples as well. Of course, hand in hand with thinking about your methods is thinking about analysis and what are you going to do to analyze the data, what steps will you take? Nicole talked about rapid analysis. There are lots of different analytic techniques we can use, with one of the critical pieces of an ethnographic lens being reflexivity. And there have been, really excellent recent papers about the role of reflexivity in heightening our attention to and consideration of equity issues, and really thinking about who we are as people collecting data or as supporting other people collecting data. And this question of who will conduct the ethnography, you saw wonderful ways of approaching this question. It doesn't have to be who we might traditionally expect to do that. And people can be trained, they can do an amazing job. They have perspectives and ways of thinking about context that we researchers might not even have access to, might not have knowledge of, might not have the background to really be able to understand what we're seeing and how we're seeing it. And thinking about, when you're using these methods, when is that going to happen? What is the logic and the rationale for the data collection approaches that you're using? Like this pre-mortem idea is anticipating, before you've even done anything, it's anticipating, here's what I think could go wrong, here's what I think could fail, which is a really interesting, point in terms of thinking about when are we collecting what types of data, and again, why those time points, and even place and space. Where will things occur? Where will things not occur? We can't be everywhere, so where are we going to use different approaches, different types of observation, thinking about who is in different settings and contexts, and how can we capitalize on that, given that a research team can't be in all these contexts at once. So just some guiding questions just to kind of think through. Again, you can replace ethnography with any other methods that you might be using. Our focus has really been on qualitative methods in this session, but certainly even within the ethnographic umbrella or outside of that umbrella, you have lots of different methods options for capturing context, and really assessing and understanding the role of context in implementation. So with that, we have about 10 minutes for questions, and then we'll head into our half an hour long, more consultation oriented session with some of you. So we're happy to take questions and also revisit some questions that have already come up. And thank you, Carrie, for our managing our slides. I think you have a question from Christina Nicole about the pre-mortem. Do you see that one?
I do, yes. So the question here for the pre-mortem, what if the process map needs to be tailored or created first? Would it be too overwhelming to do all at once? Well, I will say that we iterated on our process maps multiple times. And so there's never a perfect time to have your process map sort of ready. It has to be ready enough so that people have an idea of what the kind of program or workflow looks like. But we found that in our interviews, people gave us really helpful ideas to change the process map. So we tried to keep the process map uniform, either in the interviews or in our advisory board meetings, just so everyone was reacting to the same kind of program principles. But the feedback that we received and the perspectives from the pre-mortem or the brainwriting exercises actually helped us iterate and refine the process maps more. So I think it's, as long as you have a fairly solid map available that's understandable and somewhat coherent, it doesn't have to be the final. And in fact, it's not going to be the final process map that you make. Hopefully that's helpful, Christina.
Yeah, sorry, that's very helpful, Nicole. I asked because we have like this multi-state, like a lot of variation in probably what the process will be. So I hear your point about needing to keep kind of the buckets consistent across, but I don't know if you use it as a way for them to make sense of the process too and kind of contribute to it. But it sounds like that's a different activity than the pre-mortem. So thank you. This is so helpful.
You're welcome, Christina. Thank you.
And I see Caitlin has a hand raised. Just to touch really briefly, Caitlin, before we go to you, on Anna Kay's question about capturing more rare, comments, observations, etc., which is such a key point in terms of, qualitative methods, not only helping us to discern trends, patterns, etc., but also things that, are surprising, unusual, rare, unique, etc. My initial reaction to that would be to at the very least have a memo, develop a memo about the things that you're seeing and observing and hearing that maybe aren't, kind of those big picture, everyone's talking about X, Y, and Z, but have a place to document the less common occurrences, observations, so that we aren't losing them, and they may end up being really quite important. So you do want to document them. My approach to that would be to have a memo. You can, keep that in, like, for example, in our rapid analysis templates, we have a section for other observations. That's typically where we put things that don't fit into domains that came, from the design of the data collection instruments. So that's another place to park things. But wherever you do it, the point is not so much to do it in one specific place, but rather to make sure that you document it and know where it is, and don't forget to go back to it. Because I think sometimes we might put those things that don't fit in a place, and then we're like, oh yeah, I wrote that like 6 months ago and I never went back to it. And meanwhile, there are all these gems in it that you really did need and did want to pay attention to. So periodically, work on it, revisit it, develop it, evolve it, and make sure that it is integrated into your other analytic components. And Caitlin.
Yes, I was curious about when we think of somebody as a human subject and which parts of this need IRB approval from the beginning. It seems like definitely if you're setting up a focus group, you're prepared, you have your questions, that would probably be easy to think of comparably to other types of research. But some parts that feel like you're observing the context, or maybe talking to a stakeholder early to gain entry to a system. Like, when do you think about somebody as being a co-investigator or a research participant in your study? And just, do you have any advice about navigating those types of questions?
Great question. Nicole, do you want to address that with your, all of your community-based work in mind?
Yes, thank you. It's a great question, Caitlin, and it's actually part of the reason why this paper, which we created the mug for, was a challenge. We received some really critical and important reviews of that paper to understand sort of the ethical considerations of our ethnographic approach. We did submit that to our IRB as human subjects research, and I believe the decision was that it was considered exempt because there were minimal risks involved. And it was really, again, an observation of a process to guide a research study. So it was a bit meta, but nonetheless, we erred on the side of submitting it to our IRB, making it very clear with our advisory board members that we did have our documenters there with us. I think usually at the beginning of our meetings, we did introduce them and they shared a little bit about themselves. So we didn't want there to be any surprises or kind of secrets to what we were doing. But the kind of ethical considerations of ethnography are really important. And so I think we've always erred on the side of making it clear to people what we're doing and the purpose. And for publication reasons, you often have to indicate and explain, to what extent did you submit this as an IRB protocol? Was it approved? What was kind of the decision? So, Alison, not sure what other guidance you have about that, or sort of challenges you've wrestled with.
I think the only other thing would just be with the periodic reflections, and if Erin's with us, she may want to comment on this as well, but just that we, some of the folks who we do reflections with would have already completed at least a verbal consent if they were also participating in interviews. But for the purposes of the reflections, they're really meant for our internal knowledge processes, not to say that we wouldn't, analyze them and incorporate them into publications, but they're more of an informal approach to understanding what's happening dynamically during the course of implementation. So we're not consenting every single person that we're doing the periodic reflections with. Many of the folks doing them are members of the team. So like I do them, other PIs do them, etc. So we're more kind of using it as this internal mechanism for documenting these adaptations, changes in context, etc., and then triangulating that with other sources of data more often than not to help develop that more comprehensive understanding of context. Great question.
And Carrie is sharing this slide as a reminder that we have, I think, probably 2 more minutes left for the full group. And then we're going to move into our 30-minute consultation period. If you did register for that, I think you received a reminder or notification about that, sort of on our system, I think, about the consultation period. And then this is just a reminder about our next session, which is next Tuesday, that you're welcome to register for. But 1 more minute for big group questions. Oh, and this is a way to connect with us all.
All right, well, seems like we can move into our smaller group. Thank you so much. First of all, thank you to the UCSD Hub for our collaboration on this session. So fun to put this together with Nicole and team. And, you know, I could talk about assessing context and using ethnography all day. So thank you all for being interested in this topic, because we are certainly very enthusiastic about it. So thanks everyone for joining us. We will be sending out materials and the evaluation after the session, as we mentioned. Reach out to us if you have questions. Our hub has a playlist on YouTube, as I mentioned, and UCSD has a tremendous wealth of resources as well. So hopefully we're giving you content that supports your implementation research. And Nicole, any parting thoughts from you for the big group?
I don't think so. Thanks for staying with us. We hope to see many of you next Tuesday at 10 to learn about developing interview guides.
Thank you so much.
Thanks everyone.
We are staying here, right?
Yes.
We don't go to another link. Okay, just making sure.
No. No. Well, this may be our group here, our cozy group of 15.
Nice.
And I'm not sure if we had, many of you submitted questions ahead of time, which is great. I don't know if we know from whom they were submitted. So maybe should we just open it up to the group, Alison?
Yeah, and just for anyone who did submit, first of all, we really appreciate it because it helped us prepare. And second of all, as I mentioned earlier, we took all of your questions and did our best to find resources for each question. So there may be more, I'm sure there is, but we at least tried to take every topic or question that you had and find a few resources, whether it was a workshop or a publication or whatever it might be. So those are the sections that you'll see in our resource list. They correspond to your questions, which we tried to prepare for as much as possible. So yeah, this is your time and we can get into your questions. And anyone can start.
I'm going to pull the guide. Do you have the list of questions?
Okay, we see your question, Christina. What types of questions would you want to collect on a frequent basis as opposed to through an interview at the end of implementation? I think it's a great question. Christina, do you want to add anything to that, or are we good to go based off of that question that you submitted?
Yeah, I could just say that we're thinking about doing sort of monthly implementation coaching notes for our coaches that work with the internal facilitation teams for the intervention. And then we're also going to interview the staff plus the coaches when implementation is fully done, say like a year or so afterwards. So I just wanted to make sure that we are targeted in terms of like what's better to be collecting at those monthly implementation coaching meetings. And then what's better in terms of like, okay, now implementation is done and we want to get at like, say, acceptability, appropriateness, and feasibility of the intervention.
Right. It's a really great question. I'll share some thoughts and then see what you think, Nicole, as well. You know, for us doing the reflections, which is sort of this more, you know, frequent, like you said, during implementation data collection effort. I think what it affords us the opportunity to do is get into adaptations that are being made, you know, in real time. Oh, we changed the intervention in this way, or we had to do such and such with the strategy. And that's really hard to capture in interviews, that more dynamic nature of adaptations. Not that you wouldn't ask about adaptations at the end, but you might ask about them in a different way, and you might get more of a global, here are some of the big changes that we made, but those maybe more micro changes that you make over time, you know, in response to a particular patient or in response to a particular provider or organizational change. Those are really helpful to get at more regularly. Another thing that we have really concentrated on in our more regular data collection has been changes to context, especially like new initiatives, new policies, or the end of funding, or a meeting that took place that really shook up the organization, like anything that's happening sort of temporally that's affecting implementation, but that it's a little bit less likely to come up, or at least be as reliable in interviews as it is when we're collecting data regularly, and someone can say, oh yeah, this new policy just went into effect, or we just lost such and such funding for this program, or we merged with this other organization, or we had a flood. All these things I'm telling you are things that actually we heard about in periodic reflections. I'm not making them up. And, you know, even though it's possible that some of that stuff would come up in interviews, there's so many other things, especially like in a summative evaluation approach, that there's just so much to cover, that you might not get systematically at some of those things that are happening on the way, on the road. And so those are the things I would tend to concentrate on, are micro changes, whether those be to the context, the organization, the intervention, the strategy, the personnel. We're probably not going to capture all of that in interviews. If they're like, oh yeah, we have a new director, or we have a new team member, or so-and-so left, that type of thing, you know, it's really helpful to capture that more regularly. And there's not always going to be something happening, but just to have the opportunity to tap into it can be really helpful when you're collecting data on a more regular basis. Anything you want to add, Nicole?
I love everything you're saying, and I think the questions, again, through kind of a periodic approach, just to emphasize what you're saying, kind of asking about process and adaptations are really helpful and critical. And then the kind of outcome interviews are, again, more of a global retrospective on impact. So I think those shorter, more regular data collection opportunities are your chance to get at any process changes or kind of shorter term impacts, as well as adaptations that they may not necessarily think about unless you specifically ask them about those.
And I do find, just to build on what you just responded, Nicole. I do find, I think about it from the perspective of being the one who's providing some of the implementation information if I'm leading the effort. And I definitely have experienced that situation of the person who's asking me the question saying, has anything changed in the, external environment? And I'll be like, oh, wait, I had this meeting and and we learned this and we decided to change this and this. And so there is that sort of recall when you're being prompted that is just nice to be able to rely on that as something like I'll sort of store up things that I know I'm going to want to talk about in next month's reflection. So that might be another difference to consider between more regular data collection and interviews, because of course for interviews, people aren't preparing for them necessarily. And they are kind of thinking, oh, next month I'm going to be interviewed by Alison or something. So I think there's a little bit more of that back and forth too, between whoever is doing the data collection and whoever's providing the data, because you get used to it and you get into sort of a rhythm, which makes it really productive. Sure. Thank you. Other questions that folks submitted or that have come to mind based on what we shared today?
I can ask a question. Thank you for your talks today. They were so interesting, and it's nice to have a snapshot of different methods that we can use. I'm part of an evaluation of the naloxone expansion program in San Diego County. It's not a research project per se, because we're basically, it's more of a quality control and trying to understand challenges to kind of making naloxone more widely available in the county. And something I was trying to do was to get some qualitative snapshots of what was happening on the ground. And I thought that an effective way of doing that was to create a little WhatsApp group with all the different partners that are involved in the distribution of naloxone and training for different groups of people. And everybody was very enthusiastic about it and gave me their numbers. And I said, on a daily basis, when you do a training, if you could ask the people who are doing the trainings to just either do a little voice note or send a brief text saying, well, we encountered this and this situation, or and it's been a few weeks since I set up the chat, and there's been zero activity. There was some parallel activity at some point through the email, so not the WhatsApp group, basically resending emails that they had gotten from people they had trained, thanking them for the training, and sometimes telling a story of somebody who had used naloxone on somebody a few days after, so kind of success stories of the program. But it doesn't seem to be taking on. And I think it's partly because people are a bit uncomfortable. It's different organizations, so maybe they're uncomfortable exposing themselves to the others on that WhatsApp group. It might also be that it's just not practical, that people are on the go, and the last thing that they want to do is to briefly kind of record something. I had asked, can somebody give an example so that it just, once you have a couple of people doing it, maybe it will take on. But I just wanted to hear your advice about how to better do that. What I'm thinking at the moment is that I will contact each one individually with specific questions and say that, I will consult them before reporting those in a document to see if they're comfortable with me kind of including that or not. But yeah, I wanted to hear your thoughts.
Yeah, I mean, it definitely becomes more labor intensive if you have to follow up and ask questions of everyone. And we tried something similar in a big initiative. We were like, oh, we'll do this super brief thing where people can just jot in some notes. We weren't using WhatsApp, which is a great idea, but kind of a similar idea that we were going to ask people to just get some notes into a little platform, super quick, not burdensome, and nothing. We got like not like maybe the first day one person did it or something like that. And I was like, okay, that's not going to work. And that was actually one of the reasons why we developed the periodic reflections, is because we thought, you know, if we want to get this and we want to get it systematically and consistently, we're going to have to be involved, even though that's more work on us. So I definitely resonate with what you were saying about, you know, going to them and asking specific questions. I also wonder, and this is totally top of mind, but I wonder about even like a text reminder to say, hey, you know, you did that training today. You know, if you could just jot a few thoughts into the WhatsApp, that'd be great. Something to prompt, like I think about me, if someone prompted me and said, hey, go fill this in for 2 minutes, I probably would. But if it's on me to remember to do it, I probably wouldn't, just realistically speaking. So maybe there's something in there to try in terms of just a quick, for me, I would always prefer a text to just say, hey, don't forget to do this. But even if it's not text, like something along those lines, maybe worth a try, and it wouldn't be too hard to try, and, you know, just more trial and error to see if something like that would work. Do you have any ideas, Nicole?
Yes, I have many, and I have WhatsApp open right here because I do use it quite a bit for different people and projects. My first thought is, yes, this is sort of building a new habit for people, right? Not necessarily related to your evaluation project, but just habit formation. So for sure, I think a weekly reminder. The daily request that you made, that initially struck me as, oh, maybe that's too much. And that expectation of a daily response is setting the bar maybe too high for people. But if you were the one to just remind people on a weekly basis, hey, what went well, what didn't go well in your trainings this week? Those could be the simple 2 questions that you ask, and you send those out every Wednesday morning or something, and encourage, see if that encourages any initial responses. If it doesn't, then maybe you could consider even pairing kind of a training tip with a question. That way people are getting sort of a benefit as well as you're getting the evaluation data that might be helpful. And then my last kind of question comment is, how are you hoping to use this information? Are you hoping to kind of synthesize it and share it back with all the providers and trainers, or what's kind of your purpose in gathering this information?
Thank you. I'm taking notes because this is useful. Yeah, I mean, the main goal was mostly to collect challenges that they had experienced through time and that maybe could be addressed somehow. So, I mean, I don't know, I was kind of thinking maybe there's like stalking challenges and they're not getting the naloxone when they need it. I know that from the discussions that we've had together, they have challenges in schools because they're not allowed to provide naloxone in school. So they're meeting at the parking lot outside of the school to give kids naloxone when they come out. But they were also found that after school programs are helpful. So I'm aware of some of the challenges, but it's like really hard to anticipate before you actually have conversations with them. So I was very much hoping that they'd be like, oh, today we had this problem, like the police came when we were doing a training and we had to I was hoping for those kinds of stories so that then we could come back potentially to the county and maybe have like an agreement with law enforcement so that they leave people alone when they're doing trainings, or things like that I was kind of hoping would happen in a spontaneous, like, oh, every time they encounter a challenge, then, you know, they share it and we have this collection of issues, but also like unexpected experiences. For example, we had one of the partners being asked to do a training at the mortuary, at the morgue, basically, and she ended up spending more than 2 hours there because apparently lots of the people who work at the morgue actually have family members or friends who have been exposed to overdose and who have passed away due to an overdose. And so it ended up being a much more personal and much more meaningful training than she was expecting. She just thought, okay, like they want And so like, if I hadn't talked to her that day, I would have never found out about that experience. And I thought, well, if there's some sort of like routine habit of, oh, today I gave a training at the mortuary and this and this and this happened, then you get a much more, because at the moment we would just have mortuary, how many people were trained, how many naloxone kits were distributed, and you have no idea what happened during that training. So I was also hoping that we'd get some sort of like description of, you know, what was behind these trainings and what kind of people were you know, getting naloxone and how they were planning on using it, or if they had already used it, that kind of information basically.
That's helpful to hear.
Yeah.
But yeah, I mean, I like the idea of providing a benefit as well as a question, so that there's more of an incentive to engage.
Yeah, and I just want to underscore your point, Nicole, about thinking about what role you want the data to play in your overall data collection effort. And, you know, analytically, what are you going to do? How is it going to connect to, and how is it going to connect to other types of data that you're collecting? Because, you know, sometimes sure you won't do this, but sometimes we collect more than what we need and then we don't end up using some of it. And so it's that alignment between, I need this data for these reasons to answer these questions, and here's what I'm going to do with it analytically, is just always a good idea to keep track of.
Yeah. I mean, yeah. At this stage, it was mostly descriptive, because we're providing descriptive statistics of what's, you know, where these trainings are happening and how many. But I was hoping that we'd also get some sort of insight into, the different populations who are receiving the training. But it was also mostly focused on collecting challenges that we might be unaware of and that we might be able to solve if we know about them. But yeah, point taken.
Great, thank you.
Thank you.
For your question. What else is on folks' minds?
I can ask my question if that's right.
Yeah, of course.
I'm just starting to plan an implementation project, and I'm a clinical psychologist who has done some qualitative research, but never implementation work. And I'm trying to figure out how to be most competitive in a proposal of whether I need a co-PI who's an implementation expert, or if I can find a way to carve in consultation or something like that. So I'm only just starting to figure out, like, what does my team need to look like? And if you have any advice on how to think about that, I would really appreciate it.
Yeah, definitely. And I'm guessing that other folks who are with us will have thoughts as well. I think if it's an implementation proposal, you know, like kind of front and center, it's about implementation, then you probably, you would need an implementation scientist on your team, if not in a leadership role. Consultant probably wouldn't be enough unless it was a really like a project on the path to implementation, like a pre-implementation study where eventually you're going to get into implementation, but you know, initially you're maybe doing some learning about barriers and facilitators, that type of thing. But so I'd say the more implementation oriented it is, the more important it is that you have an implementation scientist on your team very clearly designated, and their expertise is very clearly highlighted. But that, you know, that doesn't mean that you wouldn't be developing your own expertise in that area. And I think we put a few references in the list about like developing competencies in implementation science. So what that looks like, and you know, where you might obtain that type of training and that type of thing. But I would say, you know, I've seen enough critiques of implementation proposals to say that reviewers will comment on, you know, well, there's no implementation scientist on the team, or it's a consultant who the person plans to meet with once or twice, and that's not enough. So I do think it's pretty important as to whether they're an actual MPI. I mean, I prefer MPI, I prefer team science when it comes to implementation, pretty much anything. So my approach has been more to either be the implementation science PI, or to have someone else who's in that role, you know, depending on what the topic is. But that may be more than what you need. It kind of depends on the scale and scope of the project too, I would say. But you definitely got to have someone on the team who's kind of a recognized implementation scientist with publications in that area, that type of thing. That would be my perspective on it. And Nicole, I'm not sure if you heard the whole question, but just about like if you're embarking on an implementation proposal, but don't, Caitlin's a psychologist, doesn't have a strong background in implementation science yet, if that's fair to say, but kind of wondering about team composition and having an implementation scientist on board, to what extent, that type of thing. Any other thoughts about that?
It's a very good question when we do receive often, and I apologize, my computer just decided that it needed to restart for no good reason. So sorry about that, Caitlin. I did restart before we started, and anyways, I think implementation scientists are often hard to find who have room, you know, in their portfolio, which is a struggle. And so the extent to which you can gain access to more of these different implementation science trainings. Borjika and I actually are just reaching out to the Center for Implementation. They have a implementation specialist certification that you can go through, and we're actually considering that for a couple of our master's level professionals to help with this kind of need for increased capacity for the specialized training. So I think I agree, Alison, to the extent that you can identify a co-PI or a co-I who does have that, you know, history of implementation science training or experience is helpful. And if you can also kind of increase your experience and exposure as well, I think that will only be helpful and a benefit to you.